Good afternoon, everyone. I'm just trying to put my computer here. Hold on a minute. Today, we're going to talk about facing the storm and particular crisis management. There has a lot of things that have happened recently that are inviting us to think about crisis in our agencies and in our personal life. Crisis management is the process by which an organization deals with a disruptive and unexpected event that threatens to harm the organization and or its stakeholders. There's three elements that are common into a crisis: a threat to the organization, the element of surprise, and a short decision time. The strategies for crisis management are sense making, is to collecting and processing information that allows the decision of an emergency crisis; decision making, determining a response strategy and coordinating the implementation of that strategy; meaning making, developing a narrative that resonates with people; accounting, explaining to the public what was done to prevent and manage the crisis; and learning, analyzing the causes of a response to a crisis and implementing the corrective action. There's many types of crises that could happen in the Pacific Northwest. Um, a small one could be a building fire, but we could have pandemic, wildfire, cyber attack, earthquake, tsunami, flooding, tornadoes, landslides, terrorism, winter storm, active shooter, radiological event, water contamination, volcano, and many more. If we start evaluating something as small as a kitchen, as a building fire, we will be able to start making decisions of who is going to be affected and looking at our personnel and the residents. What are we going to do? How can we manage this crisis? We need to look at the location of residents, services for the residents, building insurance, water loss, mitigation, and how to be back in operations. Some things we could do to prevent the fire and the fire damage. We could work on sprinkler systems while we are building and according with our code when we are doing rehabs. But also there are some things like smart burners that can help us reduce the cooking fires. According to statistics, 45% of multifamily fires are caused by cooking fires, and applying some prevention like smart burners or the GE Sensi burners will help us to reduce the fires in our buildings. We can also look at the history of pandemics. It happens. We have enough in our history, but we just forget about things like this. It happens in many years, and with this graph, you will be able to see some of the history of those pandemics, starting 100 years ago, where a lot of people started having different types of pandemics that have affected our population, and COVID-19 being the last one that we are still trying to go through that. This is for wildfires. This is an active map of active fires happening in the Pacific Northwest. We had many bad fires through Oregon, Washington, Idaho that have damaged many of our properties. Some of our properties could be in rural areas where they might be more affected, but cities, Seattle, Portland, there could be smoke that could affect the quality of life for our residents and employees. Cyber attacks. This is something that we didn't have to deal with many years ago, but the more that times go by, that the more these attacks increase. 21% of those attacks are by phishing attempts through our email system. It could be personal or work email. The loss or theft of equipment with private information, and many other things that our technology will put us in jeopardy with cyber attacks. Cyber attacks also increase while during an emergency or during a crisis. These there has been a lot of cyber attacks and a lot of calls trying to take money from our elderly and disabled through the pandemic. And there is a lot of information from the Interpol and many other organizations trying to help people getting information of how to keep their information safe and their savings or bank accounts safe. Earthquake. It had happened in our area. We've had a couple of earthquakes in the past. In the 1980, the Eureka earthquake, it was a magnitude 7.3, and it was in the Northern California. In 1993, the Scottsdale earthquake, the Spring Break earthquake, which was a magnitude 5.6 in the Willamette Valley. In 2001, the Nisqually earthquake, it's a magnitude 6.8. It's north of Olympia. In 1960, the Chile Valdivia earthquake, that was a magnitude 9.5. We have 2011, the Huku earthquake, magnitude 9.0. 2017, Mexico earthquake, it was a magnitude 8.1. So we've had some very close to our area and some others in the Ring of Fire. That those are the biggest earthquakes that can be recorded. We are in the Juan de Fuca subduction zone. As you can see, the blue means that those big cities are that are in the Ring of Fire have had some earthquakes in the last 50 years, but we haven't had one. And according to the statistics and some history, the average time between Cascadia subduction happens between every 246 years in average, but the last earthquake we had was 318 years ago. We have unreinforced masonry in many of our cities still. Some of our bridges, if not most of them, are old and will not be able to withstand an earthquake. Most will collapse. And there's many of normal resources that we are not ready to be able to keep them after an earthquake. There's some statistics determined by some of the public works that will give us an estimate if the subduction zone will happen in our area, that we could be without electricity from 1 to 3 months in the valley and 3 to 6 months in the coast. Police and fire stations may not be available from 2 to 4 months in the valley. Drinking water and sewer, we could have from 1 month to a year that we will not have water available or sewer available for our cities, and etc. There's a lot of places and a lot of utilities that might be jeopardized if we have a big earthquake. Because of those crises, we need to consider emergency management plans. Those disasters will happen, and then before the disaster happens, we have to have an emergency preparedness, and this must be for ourselves to prepare personally, but also to help prepare organizations. And this emergency preparedness will help us to do some work in conjunction with the business continuity to be able to have an effective emergency response. Talking about emergency preparedness, when we talk about making a plan, we talk about having a plan for your family and the buildings, because if we are personally prepared, we will be able to come back to work sooner and we will be able to serve our communities. Think, where will you go if there's a disaster while at home, and think what happens if that disaster will happen while you are at work. The kids, if you are at work, what if you have family members? What are going to be that if they are in the school? How are you going to be able to gather? How are you going to be able to go where they are located? And there is some preparation for home and for buildings that have to happen. Start an emergency kit and decide where to put it. And there's many emergency kits that we could have. One personally for our home, another one to be able to have in our work and our vehicle. There's also some catch supplies that we have prepared for some of our high rises with non-perishable food. that people will be able to gather, our residents to be able to get some essential supplies in case of an emergency. Some of the things that we don't think about is where are we going to go for pee and poo when there's a major disaster. And there's a couple of cities that have made major progress in evaluating of pee and poo. And there's the 5-gallon buckets that some high rises have developed some systems to work with those. And of course, hand sanitizer, toilet paper, and carbon material, where for people that it's in the city, but there's many other systems for rural areas that could be considered. There's many apps that could help us be prepared. The Red Cross has apps that if you go in your cell phones, you will be able to download, and it will give you information for tornado, earthquakes, and floods in your area. So you could select many areas if you live in one city or in another city to be able to keep information for all the places that you need to be informed. Something very important, learn how to shut off the utilities for your buildings, for your home, for the properties that you managed. Sometimes we are visiting a building, or if we are working at our headquarters, there is a chance that we don't know where those are. And it's a good practice for us to have a tour and learn where those are in case of an earthquake, that we are able to shut off those utilities to be able to be back in operations when available, depending on the size of the earthquake. Minimize potential hazards. And this goes for our home, for our offices, and for the buildings where we have multifamily housing. It is not easy to do, but this is a project that could take many years. Just trying to raise water heaters, trying to secure the things that are hanging from the walls, from the community rooms, from the offices, computers, TVs, and shelves, is something that will help our community to be safe. Retrofit our buildings. This is something that it's something that we discuss in multifamily housing, retrofitting homes and retrofitting multifamily housing. It's something that it could be done. There is a cost related to that, but when you look at the cost of rehabbing a property after an earthquake, there's some statistics that for every dollars that you invest in safety and retrofitting your buildings, you will save $6 in potential damages. So this is something to consider when you are working on retrofitting your buildings, or just plan to be resilient when you are building new housing. Some statistics that we have heard is that it will take approximately 1 to 10% to build new housing, the extra cost to be able to be earthquake resilient. And it depends of the size of the building and the location of the building. In working with our communities, there's a lot of things that we can also do. We can map our neighborhoods. There is important connections that we create in our neighborhoods. And when I'm talking about this, it is in our personal lives at home and also in our different communities. Building relationship is the most important. Who of our neighbors is it's doctor, a nurse, or somebody that could help us in case of an emergency, getting to know your neighbors. And in multifamily housing, when we work with resident services and property management, trying to do the same things, trying to identify who is disabled, who is going to need help in case of an emergency, to be able to help our community. It's very important for us to keep in mind who is disabled in our community. A lot of the people that we serve is vulnerable, and we need to help them have access to functional needs and focus on ability, discuss best practices for hazards, and just the drop, cover, and hold works for people with disability, but in many different ways. So just try to work with them in a way that they can identify which one will be the best that serve their disability and or ability to protect themselves, work on communication, languages, trying to talk to people with diverse backgrounds, medical equipment, transportation and accessibility. Consider becoming a NEC or a START member. This is a training that it takes about 30 hours and 12 volunteer hours. We have 15 of our employees that have gone through this course, and we are in the process of getting the trainer class to be able to ask internally to start doing these trainings for our residents and staff members to be able to make this program grow. The CERT or the MET program will help us to be able to respond and work with our communities in case of emergencies. Consider becoming an amateur radio operator. This is something that is coming back in fashion as some of the high rises that may collapse or may have issues have antennas for cell phones, so that the cell phone might not be available for a while. So the amateur radio will be a good way to communicating. And I know that Seattle has really a good communication system for their emergencies. And we are working in Portland to be able to develop with the city and the other agencies to have a good communication system as well. Take a first aid or CPR course. This is something that you can work with your safety department, or you can take to the American Red Cross. It is important for you personally and for helping the community as well. Advocate for more preparedness. There's a lot of things that we have to keep working with our leaders on how to protect our cities and how to help our community to get ready for disasters. Get to work with your schools, daycares, assisted living centers, nursing homes, and hospice care. Help them to get the training, and also they may be able to help you as well as building your community and your neighborhoods. Now, according with our emergency management plan, we're going to talk about business continuity. We've done some evaluation of identifying the risks of the disasters, emergency preparedness, and now we're going to talk about business continuity. A disaster can be built over days or weeks or hit suddenly without warning. When a disaster happens, our response could put the safety of our residents and staff. Depends on the training that we've had and depends on how we're getting prepared. We could expose to unnecessary costs, difficulties, liabilities if we haven't planned correctly. Having the right plan in place before disasters will help us to have an effective response. We in housing face unique challenges of emergency events. We have residents that we have to take care of. And we need to evaluate the disasters, to talk to them about their location, if they have people where they can stay if the building is not longer accessible. But with the analysis that we've made, most of our residents don't have another place to go. It will be very challenging, depending on the continuous operation of our buildings, how to be able to come back and how we can provide vital services to our residents and our community. We serve a very vulnerable community, and as you may already know, as we have crises and as we have disasters, it really makes a big hit in our communities. There's basic questions that we can start doing when we are doing a business continuity plan. Who is responding to a crisis, and what part of the leadership is going to be able to be available to the crisis, and who is going to be essential personnel. And we have seen some of these through COVID-19. Now, the difference with COVID from other disasters is COVID has given us some, even though it looks like it was fast and furious, there was some opportunity for us to plan, some opportunities for us to have meetings, to discuss. We have internet, we have phones. There has been some resources from other agencies, but from some other disasters that might not be available. So who is going to be able to respond to the crisis, and who is the people that is going to be able to be on site? Essential phone numbers and contact information when you don't have computer or electricity available. Leadership, personnel, vendors, first responders. Who am I going to contact in FEMA? and in HUD to be able to help me with my buildings, and what forms do I have to complete to be able to get assistance. The soonest that we can do this work, that the soonest we will be able to come back in business. Discuss things, financials, including increasing purchase card limits or getting P cards or credit cards for our staff to be able to do purchases in case of emergencies. Where are we going to print the checks if the headquarters are not longer available, and what options do we have? Very important is to work with our IT department. When doing interviews with all our directors, IT is the main department that is going to serve and is going to let us come back to business, because we will not be able to print checks if we don't have computers or printers, and if we don't have internet and phone systems, and there is a lot of things to consider. So some questions to ask is where are the servers located, and if you have a primary and a backup facility, and where those are located. The phone systems, now that with technology, a lot of our phone systems have been or are now through internet, and if there's no internet, we found that some phone systems will not be available, and you will not be able to leave voicemails, for example, and this phone system may crash. So you have to have an alternative for your residents if you have this type of phone system. So ask your IT department what type of phone systems do you have. On-call or answering service, in case of an emergency, it will be great if you have the on-call or answering service out of your state or out of the location where there could be the hazard. So residents and staff will be able to talk to them, and you'll be able to gather information through the answering service when phones are back available. Do you have enough laptops to allow people to work remotely? And we have leaked some of these things with COVID-19. We have been able to start discussing what it means to do some remote work, but some of the challenges with laptops, and trying to get laptops right now, it will be very expensive, and there's actually wait lists for some of the suppliers, because there's too much supply and demand of laptops because of COVID-19. Where is the location of your headquarters? Will you be able to have access to them? Are they close to a river, or are they close into an area where there is actually a big another high rises or buildings that might not be able to give people access to the building, or reinforced masonry? And we'll talk a little bit about that. What is the condition of the building? Is it reinforced? Or is it a building that you'll be able to have as a location for emergency where people can come to work? Most of our agencies have different systems, so there's no cookie cutters for us to be able to determine if our building will survive an earthquake, and if we're going to be able to run operations from them. We need to do some work. And if we are not able to come back to our building, so what could be alternative locations? And if people is able to work from home, what are we going to do for our staff to be able to accomplish that? We also would like to talk about the incident command system, and this is a system created by FEMA that has general vocabulary and job descriptions in terms of an emergency, so people can know what their tasks are. And when we are talking to HUD, when we are talking to FEMA, the terms and the language is the same. It is very important that we are talking about the incident commander, that everybody knows who the incident commander is. The incident commander is not necessarily the CEO of the organization. It could be somebody that is going to be able to take action while we are going through an emergency, or we can take shifts. There's many ways of having an incident command system. So take the time to evaluate how you can do this system in your organization, and start talking to your staff of who is going to be in charge of external communications, who is going to be the chiefs of logistics, the business operation or business continuity chiefs, and the housing chief, to be able to work with our community and with our residents. There is trainings that are free, offered by FEMA, that will be able to help us to learn these systems. It's very bureaucratic, but it's the way that we need to go through to be able to get our funding, and to be able to speak the same language that FEMA does. And there is many courses that we can take. True resilience is not having a fortified home that can stand in isolation with abundance of toilet paper. True resilience is our relationship to each other. Because of whatever those relationships exist, home will rebuild itself. And this was said by Shannon Hayes after following Hurricane Irene. A lot of the things that we need to prepare, and when you're building your business continuity, is it's about building relationships. Who can help me? Who can I go to? And when we were building our business operations and our business continuity plan, we started asking to other agencies, and we were talking to people. What have you done? And what do you have to be able to create? And just look for other agencies like Home Forward or Seattle Housing Authority to evaluate what they've done, so you don't have to go or to start from the scratch. That there's agencies out there that might be able to help you with business continuity and crisis management. We have some time for questions. Feel free to do it in the chat or to unmute. I don't know, Shelly, this is an option.
Yeah, we'll give everybody just a few moments to, if they'll have questions, to put them in the chat.
Do any of you have questions specific about the work that has happened with COVID-19? Were your agencies prepared for this? And what did you do to prepare for COVID? When we started working on our emergency management plan and our business continuity, we identify some risks that we needed to take care of, especially from the IT perspective. We started relocating our service to a colo, changing our phone system to out of state and to a system that will be able to stand if there was no internet, for at least to receive voicemails from our residents. And we were able to add to the budget some IT budgets to be able to buy laptops and some other technology. And this was made last year. So at the beginning of this year, we started buying those supplies and making those changes. So in March, when we started having the conversations about COVID, when COVID was first seen in Seattle, we started to take an action into our plans, and we started talking about working from home and what we were going to do. In March, I would say that 90% of our staff was working remotely. They all had laptops available, and we were able to do essential work and essential personal work for people to be able to perform their duties and to be able to do their work remotely. And at properties, that they were able to respond to the emergencies as required. I don't think that agencies were not totally ready for COVID, but we were able to get some information some basic information, talk to our directors of what's going to happen when your employees start getting tested positive for COVID. we, at the time, when as soon as I think it was November, December, when we started hearing about COVID-19, we started working or ordering N95s in December and January. It was already, there was not much supply of it, but we started doing orders as we had the opportunity. So when we started working with our maintenance, we had enough supplies in our buildings, and we had enough supplies for our staff to be able to work safely. We also work with many agencies to be able to provide masks for our residents at no cost. We, as I said, because of vulnerability, our residents might not be able to have the information or the cost of, or will not have the financials to be able to buy what they need. We created many informational flyers and posters to be able to post through the buildings, to be able to help our residents to understand the safety of wearing masks. So I see in the chat that somebody was passing out masks to their communities as well. At the beginning, there was a lot of information about getting ready and having masks, and then no mask for not everybody has to wear masks, and yes, everybody has to wear masks. So there was a lot of misinformation and a lot of different information received by many agencies. So we decided to stick with the CDC recommendations, and we decided to follow OSHA requirements to keep our staff safe. We were able to have enough, and as of today, we have enough supplies to be in the same operations as we are today for another year. We have enough PPE for our staff to be able to stay in those operations. COVID-19 also showed us how important it was, or it is, to start planning for the Cascade subduction zone earthquake. Because as I said before, we've had planning, we've had ways of communicate, we still have supermarkets open, we still have transportation opportunities. But in an earthquake, we might not have those things available. So this is a really good opportunity for our employees and staff to start personally discussing safety for at home and preparedness for our buildings as well. Do we have any additional questions about crisis management? Particularly, we can keep talking about COVID-19 or subduction zone. We will be able to, we will have the presentation available after the conference to download. You will receive a link and you will be able to access the presentation as needed. My contact information is in the presentation as well, if you will need to contact us for any question that you may have. Are there any additional questions about crisis management or COVID-19? Oh, thank you. Somebody is asking about what work we've done with our residents to work in emergency preparedness. We did a focus group where we talked approximately to 250 of our residents. We went to each building to ask our residents what they thought it was a crisis for them and what they thought of preparedness. And we actually found some interesting things. When we were talking particularly with the high rises, we found that the crises were different than our family properties. There was a lot of conversation for high rises that had people that were elderly or disabled, a lot of questions about the elevator. It is a crisis for our residents when they live in a high rise and the elevator is not functional. And if there's only one elevator or both elevators are down, on how they're going to be able to obtain services. A lot of our residents have many concerns of having crisis management plans when the elevators are not functioning, that we are able to provide services for our residents, to be able to give them a phone number where they could call for resident services to help. A lot of the times it's not that something gets broken in the apartment, but somebody it needs some medicine or needs food or has a particular need because of the disability or mobility impairment. So there was a lot of questions and requests from our residents to start working with them to do a crisis management plan for the elevator being down, even though the elevator was not part of the disasters that we listed in our business continuity plan. It is something that we are working with our property management company and resident services to be able to work with our residents to help them to go through these through that elevator that gets broken. The second one was a fire. Fire, it is listed on our crisis list, but the concerns from the residents were, I'm going to lose my personal things, and your insurance is not going to take care of my things, and I don't have money to cover renter's insurance. So what is going to happen if there's a fire in my building? I'm going to lose everything that I have. So there was a lot of information to provide to our residents about the benefits of renter's insurance, and to talk and discuss on how to use their phones or the intranet or some of the accounts to be able to hold documents or pictures that if something happened in the building, that they are able to save the information that they need. But some of their concerns is about losing what they have. And for the earthquake, the concern was very similar. Where am I going to live? I don't have a place to go. And we were looking at some data from Japan, where the most vulnerable people, the 10% of the most vulnerable residents were still not relocated, and they were still living in temporary housing or shelters because there was no place for them to go. And that is something that our residents are concerned about, and where are they going to go, and if they don't have a place to go. Well, if there is a massive earthquake with a lot of high rises are down, if there is enough tents for people to be in the parking lots, and if where is people gonna shelter in place if there's no shelters in the city, that it will not be enough shelters in the city. So our residents are expressing concerns about what's gonna happen if Cascadia happens in the next year as well. How are we gonna be able to respond? We also found a lot of concerns from our staff. Our building is in downtown Portland, close to the river, and it's unreinforced masonry. It had some, through the rehab, it had some reinforcement, but we don't know the performance of the building, but we don't think that the building is going to be able to stay put after a major earthquake, and we will not be able to come back to our headquarters for a while if there is a major earthquake. So we've had to have plannings and in other buildings and in other ways for us to be able to come back to operations. Because I said it before, the soonest that we are ready to come back to work is the soonest that we are going to be able to help our community to be back, to be able to have people back in our buildings and to be able to have people back to go to their jobs. But in cities as big as Seattle or Portland, there is many hazards and there is many things that may take many, many months to be able to be back to normal. Thank you for your questions. Any other questions? Do we have somebody in the room that has participated in business continuity plans or that would like to share some of the conversations about business continuity plans, or somebody that does not have any business continuity plans for their agencies. We, as I said, we finished our updated business continuity plan in December of last year, and business continuity plan will give us basic information, very general information, and when we finish it, I think it was about October, November, and when we had COVID, the needs were different. So we started changing the business continuity plan through the disaster. So we are hoping to do a business continuity plan specific for each of the categories that goes into the crisis types. So we could have one for fires, one for earthquake, one for floods, because the response and it will be different. Some things will just be different. So we want to go to that level to be able to have some templates and some basic information to be able to provide to all buildings. At the same time, we want to do a business continuity per building. Our headquarter building is going to be very different to the other multifamily buildings that we have. So we would like to, the shut-offs, we want to do mappings of the shut-offs, of a list of residents that may need assistance, of possibilities that we need to identify, that we could have the emergency action plan and a business continuity plan per building to be able to be ready for, particularly for the earthquake. This is our goal, to start with the earthquake, because we don't know when that's going to happen. Any other questions? I cannot see more questions in the chat. Shelley, is there something else that you would like to tell the group?
All right. Well, thank you so much, Carolina, for all that great information. And we will be able to, we are going to be sending out our points after the conference. So no, I think there might be one more question in the chat. Did you see that? I think it just came through.
Randy just stated that they completed the CERT training, but didn't really think on how to use it in the work setting. So when we were doing the CERT or the NET certification, we were just talking to our staff of how important it will be for their homes and their communities, in the personal perspective, and we allowed our staff to take these classes during office hours, and we actually had it in March, the training, but we had to suspend it because of COVID. But the idea is that we keep doing this with our staff and with our residents. The more that we can talk about this, the more that we give tools to our staff and tools to our residents to be independent and to be able to work during an emergency, the better that it will be for an emergency. It will, if an earthquake happens, it will take days, if not weeks, for staff to be able to respond to the building. So our residents or site staff that might be in the building are the ones that will take leadership in the work that had to happen in that building. So it is a really good way for us to use it at work and to be able to use the tools. And they teach us how to use a fire extinguisher. They teach us how to use a pole to be able to move bricks or solid things to be able to move people out of the buildings. They teach you how to be able to color code areas in the building, how to label the building. There's a lot of good things that you can learn. There's some, if you've done the CERT, there's a lot of other trainings that you can take, and you can also, it's not valid in Oregon and Washington yet, but California has some trainings that will help you to do some inspections for the buildings to assess if the building is at risk, or if it needs engineer to look at the building, and it will help you to look after the flood or after an earthquake to it's a quick inspection to be able to help engineers. Our cities will not have enough engineers to check all the buildings after each earthquake. The problem with an earthquake is it's not only one earthquake, there's a lot of earthquakes that follow the big earthquake. So after each earthquake, there has to be an inspection of the buildings to make sure if the building is still or livable or accessible, and we don't have enough engineers. So California has a plan, and they do some of these trainings in Oregon and Washington, even though the cities have not adopted it. But it could be that after an earthquake, that the cities will let us, the people that is certified to use those certificates to help the officers do the inspections of the building. So that is it's a really good training as well. Thank you, Brandy.
All right, thank you so much.